Urinary syndrome refers to a collection of symptoms related to the urinary tract and may encompass various conditions affecting the bladder, urethra, and kidneys. The terminology can vary, but it often relates to urinary tract infections, interstitial cystitis, bladder dysfunction, or other urological disorders. Below are detailed sections on etiology, symptoms, diagnosis, and treatment options, including a group of drugs with dosages. The etiology of urinary syndrome can be multifactorial, including 1. Infections, most commonly urinary tract infections caused by bacteria such as Escherichia coli. 2. Inflammatory conditions. Interstitial cystitis or bladder inflammation can occur due to autoimmune disorders or irritants. 3. Obstructive causes. Kidney stones, prostate enlargement, or tumors can obstruct urine flow and lead to symptoms. 4. Neurological disorders. Conditions like multiple sclerosis or spinal cord injuries can affect bladder control. And 5. Genetic factors. Some individuals may have a predisposition to urinary disorders due to genetic factors. Symptoms associated with urinary syndrome may include 1. Dysuria, painful urination or burning sensation. 2. Increased frequency, a need to urinate more often than usual. 3. Urgency, a sudden and strong desire to urinate. 4. Nocturia, frequent urination during the night. 5. Hematuria, blood in the urine. 6. Urinary incontinence, involuntary leakage of urine. 7. Lower abdominal pain, discomfort or pain in the lower abdomen. And 8. Foul-smelling urine. Changes in urine odor may occur with infection. Diagnosis of urinary syndrome typically involves several steps. First, there is the medical history. This includes an assessment of symptoms, medical history, and urinary habits. Next, a physical examination is performed. For women, this includes a pelvic examination, and for men, a rectal examination to assess the prostate. Then we move on to laboratory tests. A urinalysis is done to detect signs of infection, blood, or crystals. A urine culture is also conducted to identify specific pathogens. Imaging studies are another crucial step. An ultrasound is used to visualize the kidneys and bladder. Additionally, a CT scan or MRI may be performed to assess for stones or tumors. Finally, a cystoscopy is done. This procedure allows for direct visualization of the bladder and urethra. Treatment for urinary syndrome often depends on the underlying cause. Here's a group of drugs commonly used, along with their dosages. For bacterial infections, antibiotics are commonly prescribed. Nitrofurantoin is taken at 100 mg orally twice daily for 5 to 7 days. Trimethoprim sulfamethoxazole is taken at 100–800 mg orally twice daily for 3 days. Ciprofloxacin is taken at 500 mg orally twice daily for 3 days. Let's talk about antispasmodics, which are used to relieve bladder spasms. Oxybutynin is taken at 5 mg orally 2 to 3 times daily and may be increased to 10 mg. Toltrodine is taken at 2 mg orally, twice daily, or 4 mg extended, release once daily. Analgesics for pain relief can be crucial in managing symptoms. One commonly used analgesic is phenazopyridine. The recommended dosage is 200 mg taken orally 3 times daily, but only for up to 2 days, and it's typically used in conjunction with antibiotics. When a fungal infection is suspected, antifungals are the go-to treatment. Fluconazole is often prescribed for candidiasis. The standard dosage is 150 mg taken orally as a single dose. Bladder protectants are often used for interstitial cystitis. One common medication is pentosan polysulfate sodium, taken as 100 mg orally 3 times daily. Hormonal treatment can be beneficial for postmenopausal women. Estrogen cream is typically applied locally to the vaginal area as directed by a physician. Managing urinary syndrome requires a comprehensive approach, including identifying the underlying cause and appropriate treatment. It's essential for individuals experiencing symptoms to consult a healthcare professional for an accurate diagnosis and tailored treatment. Regular follow-ups and lifestyle modifications may also aid in managing symptoms and preventing recurrence. Thanks for watching. Like, share, and subscribe.